All right, clinical conversations on today's Smart Chiropractor show. We are featuring Dr. Jason Saunders, and he is really an expert in hyperbaric oxygen therapy, HBOT. This is something that I have been learning a lot about over the last year or two. I heard about it a few years ago. I continue to learn more about it as time goes on, and Dr. Jason put together a fantastic presentation that we featured during Access. We're going to share a little bit of that presentation with you right now on Clinical Conversations on today's episode of the Smart Chiropractor Show.
Hi, I'm Dr. Jason Saunders with HBOT USA, and welcome. Today we're going to talk about hyperbaric oxygen, how it works, why it works, and ultimately how to implement it into your clinic, not only to improve the outcomes you get with your patients, but also to actually build a successful side business within your chiropractic clinic. So without further ado, let's jump right in. Okay, here we go. Harnessing the healing power of oxygen. So we're going to talk today about how to start to create freedom within your clinic, building a successful side business, but most importantly, maintaining congruency with your mission and your values within your clinic. You see, hyperbaric oxygen is one of those modalities that a lot of patients are looking for. And at the same time, in my opinion, while we want to build very successful practices, we have to maintain congruency with our values. One of my mentors and close friends, Patrick Gentempo, has talked about this for years. And as long as the business we're building is congruent with our values within our clinic, we can expect to grow a great and successful business, both in terms of patient outcomes, but also in terms of financial success. And so it's critical to me as we go through this, that the folks who would want to implement this type of strategy within their clinic feel that it's ultimately very congruent with what they're already doing, how they're already practicing. So we're going to go over a handful of different pieces today. We're going to go over an introduction, overview of what hyperbaric oxygen is. We're going to go over HBOT 101, the basics of the science. We're going to go over some of the benefits, both the short and the long-term benefits of using hyperbaric oxygen. And then at the end, I want to go over our business model just to better understand exactly what we're doing and how we're helping other practitioners utilize this technology and build successful businesses within their clinic. So let's get into the introduction. See, we've all done this before. You know, if you're like me, and, you know, by the way, I've done this far more than I'd like to admit, but we've all bought a piece of equipment. We thought it'd be a good idea. We spend some time educating our patients, but we really don't have a strategy for how to build a business or how to build a model or how to create the policies and the procedures in the clinic necessary to use this piece of equipment. And that happened to us with hyperbaric too. We started utilizing this therapy. We weren't exactly sure how to use it. And for years, once in a while, for a really tough patient, we might put them in here, we might utilize the therapy, but ultimately it wasn't a big part of our strategy. Figuring that out has led to enormous breakthroughs for us. And that's really what I want to share with you today. And ultimately, you know, the fact that we've built these policies and procedures, we're now helping other practitioners just like yourself implement technology like this very successfully. And so, you know, I hope to be able to introduce you to some of these concepts as we go along. So not only is hyperbaric oxygen well-researched, you know, at times people would have said, well, there's really not a lot of research for something like this. That is very much false at this point. There are thousands of great articles using hyperbaric oxygen. It's also unusually safe. It's really just pressure and oxygen. And, you know, being in this pressurized environment, amazing changes happen to us physiologically, which we'll go over, but it's such a safe therapy to implement for so many different kinds of cases. It's unusually effective. Usually when we operate a new piece of equipment or we're trying to do some type of treatment, there's always this risk reward benefit. And hyperbaric is one of those things where the risk is actually very, very low. And yet the benefits are extraordinarily high. And so it's one of those amazing therapies that has a low risk, but high benefit ratio. It's philosophically congruent, in my opinion, as far as chiropractic goes. The body heals itself. And so all we're really doing is we're delivering a new ingredient to this patient to help increase the likelihood of having a healing response. It's great chiropractic cross-referral. In other words, there are a lot of patients who would come in for hyperbaric who also need chiropractic care, and vice versa. There are tons of chiropractic patients that would benefit from this boost of increased oxygen from a healing and inflammatory standpoint. One of the most important pieces is that patients are already looking for it. And so part of our marketing strategy is a way to just make sure that patients are actually able to find us more than it is marketing the actual tool itself. It's really just making ourselves easily available for patients to find us and come into our clinic for care. And one of the most important pieces is it's not just a treatment modality. It's not like you're adding ultrasound or laser or electric stim, and it's just another modality to offer your patients. Literally, it by itself is an entire business model that you could utilize that's almost a separate entity or a separate business if you wanted it to be from your clinic. And so that's one of the things I really want to talk about, because that business model is scalable and that business is not tied to your time or your hands. And so that's one of the biggest breakthroughs, I think, with this technology as far as the business goes. So why aren't more practitioners using this? You'll see that when we start talking about some of the benefits, short and long term, it seems like it's almost too good to be true. And I'll try to clarify all those pieces as best as I can as we go. But you'd think, well, if it's so safe and so effective, why aren't more people utilizing this therapy? And one of the things is that there's still so many myths around hyperbaric. And those myths are leading to misunderstandings. And those misunderstandings are ultimately leading to miscommunications and ultimately underutilization. What we're trying to do, HBOT USA's mission is to try to reduce the myths, improve the education, have people really understand how this technology works, why it works, and how safe it is, so that we can basically get away from all of these misunderstandings and underutilization and ultimately bring hyperbaric oxygen to our patient base and to our communities. I also very strongly believe that chiropractors in general should own this, this side of hyperbaric, the side of hyperbaric where we're really looking for what we will call off-label use for now, not part of the traditional hyperbaric, treatment, but all these other indications. There's only 14 insurance indications in the US for using hyperbaric, but there's over 150 internationally recognized indications that clinics like yours and mine could easily be using hyperbaric for. And that's really what our focus happens to be. So whether you're new into practice or you've been around for a long time, whether you have a cash practice or an insurance-based practice, by the way, the majority of this type of hyperbaric care is all cash-based. And so if you're a cash-based practice, easy transition. If you're an insurance-based practice, it's a great tool to start transitioning some of your cash flow into your practice into more of a cash model as opposed to the insurance model. And so regardless of what your background and how you practice, if you choose that this is a great tool for you, we have solutions for helping you implement that into your practice. And a big piece of this is understanding exactly how and why hyperbaric works, but ultimately how it works and why nothing else that we have available right now can actually do what hyperbaric can do. So let me tell you a little bit of story. I think everyone on this call would agree that the body is a self-healing and self-regulating organism. It's one of the first things that we all learn in school. And so obviously I'm a very strong believer in this. And in the background is a house. That was the first house that I bought. And my wife and I, remodeled that house and practiced out of that house for years. And early on into practice, I put a new roof on that house, the roof you're looking at in that picture. I put that roof on that house. But in the process, I blew 2 discs in my lower back. And as a result of blowing those 2 discs, obviously, not being able to practice for a few weeks. Luckily, my wife's also a chiropractor, so I was getting treated. The issue was I was left with right-sided neuropathy. I was actually left with a right-sided drop foot. And 6 months later, a year later, 18 months later, still, I had a full drop foot. At the time, not only was I remodeling this house, we were training for triathlon. So not only was I not running or biking, I could barely walk. I was literally dragging my right leg around. We were actually at a Parker seminar and we were walking around the vendor area and there were hyperbaric chambers. I had no idea what they were at the time. It looked interesting to me. So I asked, okay, they were doing sample sessions. I asked if I could go in and take it for a spin. So of course the guy lets me do it. I do about a 20-minute session. Felt interesting, didn't really notice much. I got out and started walking around the rest of the vendor hall. And within about 15 or 20 minutes, I started getting almost like a tingling, a numbness and tingling into my right foot, which I hadn't felt in over 18 months at that point. And so I started thinking, wow, am I feeling my foot? Is that something to do with that chamber I was just in? Long story short, they agreed to do in 20-minute increments. I did a few hours worth of treatment over the course of 4 or 5 days in Las Vegas at Parker. And sure enough, I left that show with about 15-20% recovery in my foot. So needless to say, I bought a chamber at that point. I had no interest or intent of using that chamber in clinical practice. I just wanted it for myself. So I bought it and I self-treated. And within a matter of weeks, I got total function back in my foot. And so the point is, yeah, I do believe that we are self-regulating and self-healing. And there are certain times where something gets in our way, that we're not able to get the full recovery that we were wanting because of either something like toxicity or deficiency. Again, I believe that most of you on this call would agree that toxicity in many different ways, emotional, chemical, physical, right? Toxicity or deficiency could be one of those factors that's leading to the inability of the body to fully express its optimal health. Sometimes oxygen is that deficiency. And that's the point of the story. While I was getting better, I was doing the right nutrition, I was doing the right exercises. Exercise physiology is my background. I have a diploma in nutrition. Like I was doing all the things I knew how to do, but nothing got my foot back until I got the amount and type of oxygen I needed to really push that healing response over the hump. And so let's talk a little bit about chronic illness. And listen, this is true whether we're talking about autoimmune diseases in many cases. This is true whether we're talking about chronic traumatic issues, whether it's an acute trauma or a chronic injury or neurologic disease, degenerative neurologic disease. This system is something that we see in so many different patients. Usually, and we could start anywhere on this cycle and continue, but we'll start with decreased blood flow for a number of reasons: toxicity, trauma, whatever the issue is, we get a decrease in blood flow. As a result of the decrease in blood flow, we get an increase in inflammation. The body can't get oxygen into the area. and it can't pull the waste products away. And so literally those cells start to bathe in inflammation. As a result of that increased inflammation, we end up with metabolic dysregulation. Now the cells can't utilize or make enough energy, ATP, through the mitochondria because it's not bringing in all the nutrients that it requires. As a result of this metabolic dysregulation and the inflammation building up, we begin to get immune system dysregulation. We get an increase in oxidative stress, leading to either genetic or epigenetic damage, and then eventually cellular damage and then tissue damage. And as long as we live in that cycle just continues to repeat itself, where tissue damage then goes back to capillary damage, which would further decrease the blood flow, which will further increase the inflammation, and so on. And so this is the chronic illness cycle that we see in so many, sometimes in ourselves or our family, but in so many of the patients that we all treat every day. So what is hyperbaric oxygen? And exactly why is it that I keep saying that hyperbaric oxygen can do something that nothing else can do? Let's get into this. It's all about creating a reservoir of oxygen, more oxygen than we could normally get under normal physiologic conditions. What does that mean? We've all had a pulse oximeter put on our finger before. And ultimately, what is that measuring? That's measuring the percentage of our red blood cells that actually has oxygen attached to it. And so most of us, if you don't have a cardiovascular issue, no lung disorders, for the most part, we're all living somewhere between 96 and 100% oxygenated on our red blood cells, meaning, we can handle maybe 1 or 2 or 3% more oxygen at any time, relative to the amount that we're actually all getting. And so ultimately, we're very close to fully saturated. And what's interesting is we need to be fully saturated virtually every minute of every day just to have normal cell function, normal physiologic function. And so I look at oxygen as a nutrient. Again, we talked a little bit about deficiency. I believe that oxygen at times we could become deficient in. So let's talk about that concept. It's interesting that when it comes to food or water, right? Food, you could go days, you can go weeks, you can go months without eating food and be totally fine. Water, we can go days without water and still survive. But oxygen, we can barely go minutes without resupplying ourselves with a normal amount of oxygen, meaning we need to be almost 100% saturated every minute of every day just to have normal function. Meanwhile, we virtually have zero reservoir of extra oxygen to hold us over, God forbid something go wrong. And so oxygen is not only a nutrient, it's a critical nutrient. It might be the most important nutrient that we get when it comes to cell function and ATP production.
All right. That was Dr. Jason Saunders talking about hyperbaric oxygen therapy. Jason, hyperbaric's been something I've wanted to do for years. I have not yet had the opportunity to get in and try it out myself. I don't think there's a presentation that I don't see some sort of metabolic disorders, either super common or in the population, or one of the causes of many issues that are going on. And it seems as though hyperbaric might be a part of that solution. My question to you, I'm curious. Do you have any experience in hyperbaric, and maybe what was a takeaway that you had from Dr. Jason Saunders' presentation?
We both spent time with Jason and his wife, and I'd opened my eyes to this HBOT concept. I'd seen it at seminars over the decades, and I'd always sort of gone, what's that silly looking cigar tube people keep putting themselves in, and I didn't really pay much attention to it. But, through a friend, I started listening and paying attention. My belief had previously been, well, that's not chiropractic. I'm a chiropractor, so I must not need to know. But the reality is, yes, I've tried it on multiple occasions. In fact, I sort of make it a habit of any time I go to an event where there is one, I try to see if I can schedule myself some time. It's not inexpensive. I've priced it out locally. I got to say, it conceptually makes all the sense in the world. The science makes sense. The concept makes sense. Chiropractors are notorious for, talking about how long we couldn't live without food, without water, without oxygen, without nerve supply. We know it's an essential ingredient to life. So it fits pretty much, I think, philosophically square into this is one of those natural things that's a good thing for us to have an abundance of. I can't say I've had any miraculous healing experiences. I'll say, thankfully, I haven't had any major wounds or any major diseases or concerns that I would feel or notice any significant changes. But I've enjoyed it. It's certainly relaxing. Nothing negative about it, that I've ever had any negative experiences with. And I'll continue to do it even more because it makes sense to me. There's plenty of things I do that don't always feel good, like exercise and some other things that you do because you know it's good for you. And it's just another deposit into the do something positive for your health and well-being account. And I don't think we can make too many of those deposits these days. So great idea. Whether I think, again, if you're a chiropractor, we present this information, I think, with the mindset of some of you are never going to do this for yourselves or your practice, but it is wise to be knowledgeable about it. Others of you may say, you know what? I have training in this background, or I attract a particular type of client or patient. This fits in your wheelhouse and in your training, and you think it's a good idea to offer. I think it's a wonderful thing. And, Jason's a great guy, terrific team he's got there. He's very passionate about teaching chiropractors specifically about, how to implement this. And I'll just sort of wrap it up by saying, in our model that we're bringing to the profession about monthly recurring revenue, this does fit into one of those types of membership options. If you're looking to figure out ways that you can be generating monthly recurring revenue through some sort of membership, whether it's a drop ship subscription of supplements to your patient's doors, whether it's a monthly visit in your practice, whether it's a group coaching program of some sort, or whether it's a service just like this that may not be an adjustment, but maybe something that people would in fact join a monthly membership in order to be able to have access to. I think it's a great information, great technology, great idea. And I think it's just another one of those smart ways that you can consider either being more knowledgeable and or providing these types of services to your people in your community.
I agree. I first came upon this in the professional athlete space, and tie into a conversation we're going to have later on today's show where we speak with Dr. Ben Johnson, Tennessee Titans chiro, and I saw professional athletes utilizing this, and now I've seen it, like many things, sort of trickle down, to be able to be utilized by just about anybody out there. So thank you, Dr. Jason Saunders, for coming on, talking about Hyperbaric, and we really appreciate it during Access. Great to recap and touch base again. If you're interested, if you're listening and watching right now and you're interested, please reach out to Dr. Jason Saunders at HBOT, and he can give you all the information you need about Hyperbaric and what it could mean for your patients in your practice. Hey, if you like that video, be sure to subscribe to the Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.